Dr. Jeff talks love, Dr. Jeff talks life, answers your questions, cuts through the strife. Sex and intimacy, real and true, evidence-based, made just for you.
Greetings and welcome to Dr. Jeff Talks About Sex and Intimacy, the podcast where we explore anything and everything relevant to sexual health, relationships, and intimacy. Thank you for joining us today live, or if you're on the recording, for episode 41, Penile Injections, the good, the bad, and the keys to success. Thank you for being here. You are the reason this podcast exists, and we truly appreciate your presence here. So thank you. October is Breast Cancer Awareness Month, and I want to take a moment to honor and acknowledge everyone who is living with breast cancer or a breast cancer survivor. It has truly been an honor and a privilege to care for you in your journey towards healing. So here's to you. We salute all the breast cancer patients and survivors. We are on social media. We're out there. We're on Facebook. We're on YouTube. We're on X. We're on LinkedIn. And also on Kick. If you're on X and you have a question, go to YouTube, LinkedIn, Facebook, StreamYard, or Kick, and you can submit those questions there. If you are a Facebook person, the more people that follow us on Facebook, the more we can do on Facebook. Please follow us on Facebook. We truly appreciate our followers. Go to the website. We have had the most amazing guests on this podcast, and there's 40 previous podcasts, and we have a great one for you tonight. Watch any of the previous podcasts. It's all free. You can also pull up the calendar, see what's coming up for the rest of the year, because we have such awesome guests on, and I hope you will find out more about it by going to our website. Listen to us. We are where you are. If you're working out, if you're in the car, we're there with you. We're on your favorite streaming service like Spotify or Amazon Music or iHeartRadio or whatever you do you're streaming on. We will be there with you to work out with you or to be in the car with you as you roll along. So the goal of the podcast is pretty simple. It is to enlighten and empower you with the information you need to make your own informed decisions about sexual health and to deepen your loving relationships with those you love. Who doesn't want more of that? I want to remind you that all are welcome here, everyone. Whatever your sexual orientation, your gender identity, or your relationship style, you are truly welcome on Dr. Jeff Talks About Sex and Intimacy. So welcome. In today's podcast episode, we're going to talk about penile injections, the good, the bad, and the keys to success. Today, we're diving into a topic that many men and their partners want to understand better, penile injections. But let's be honest, really, it sounds frightening and scary and awful. I know the thought of a shot in your penis is just, it doesn't sound good. I understand that. But despite that, penile injections can be one of the most efficacious, effective treatments for erectile dysfunction when used correctly. They're not for everybody, and we're not here to persuade you or dissuade you to do penile injections. We're just here to help you understand them fully and to also enhance what you do with your provider one-on-one to help you safely use those injections. Nothing replaces one-on-one training in the office, and you absolutely should do that. One-on-one, try your first injection in the clinic under supervision with help to make sure you are comfortable, you and your partner, or you are comfortable doing those injections. This is just more information to help you to succeed and also to be safe with all of it. Remember, the most important key to success is working closely under the supervision of a trained professional. Experienced one-on-one training is essential to success for sure. We're going to provide very practical information, including common challenges and pitfalls, and most importantly, the keys to success to injections. As you may recall, I personally am a board-certified advanced practice urology clinical nurse specialist with full prescriptive authority and privileges, and have taught over 1,000 men. That's crazy to think about, but I've taught over 1,000 men how to do penile injections in the past. Again, I never persuade or dissuade you. I'm not going to tell you you should or shouldn't do this. Only you know the answer to that and have a comfort level with it. I just want to give you the information you need to make your own informed choices about that. I have published several publications about penile injections, and one of them I will highlight about pain with injections. We'll talk about that today, but I have published several articles about it and spoken extensively on it. But today, you have two of us, and I have this amazing colleague and friend, Dr. Kristen Farling. She is a nurse practitioner. She is a sexual medicine expert who has helped countless men regain confidence and intimacy through injection therapy and other therapies. Dr. Kristen Farling is a nationally recognized nurse practitioner specializing in men's sexual health and reproductive health. With years of experience in urology and sexual medicine, she has become a trusted expert in treating erectile dysfunction, Peyronie's disease, and other conditions affecting male sexual function. Kristen is known for her compassionate, patient-centered care and approach to helping men not only to master the technical aspects of penile injection therapy, but also to overcome the emotional and relational hurdles that can come with sexual dysfunction. I am so excited to welcome my guest, Dr. Kristen Farling. Thank you for being here, Kristen. I'm so glad you're here with me tonight.
Oh, it's my pleasure, Jeff. Thank you. Thank you for this invitation.
And how fun to get to talk about these injections and really train people and help them understand it better beyond what they do one-on-one under supervision with their own provider.
Oh, it's one of my favorite options for erectile dysfunction, and I just wish more men were aware of it. You know, it's a fantastic option.
Well, now more are going to be aware of it. Let's get started with our slides. All right, so penile injections, the good, the bad, and the other. Again, nothing replaces one-on-one training under supervision with a trained professional. Your first injection should absolutely be done in the clinic. Whoever's going to be giving the injection, yourself or your partner, should do it right in the clinic under supervision. You should study all this so you feel more comfortable before you walk into the clinic. There are handouts that we give out in our clinic. I'm sure, Kristen, you do as well. You can study those ahead of time. You can go online to edx.com, and there they have a handout as well as a video that you can watch. And I'll talk about that more in a little bit if you're using that particular FDA-approved drug for injections. Some men are, but many men are using Trimix and other off-label injections that have been around for many years. We're not trying to persuade you or dissuade you. I can't say that strong enough. We're just trying to inform you. Because when you're informed, you can make your own, you're empowered to make your own decision. So without further ado, Kristen, tell us a bit about those penile injections.
Yes, well, injection therapy has been around for a long time. It's been around since the 1980s. It is a very effective medication. And as I mentioned earlier, I wish more men knew about it. It is very common. It is used by so many different people, but men tend to keep things close to their chest. They don't always talk to their friends or their colleagues about their sexual health. And hopefully by listening to this, you'll be able to be a cheerleader for this event or for this very, very common condition of erectile dysfunction, which as we age, our erections naturally fade, and we got many different disease processes that increase our risk for erectile dysfunction as well. So it's very, very common. But when we think about erectile dysfunction and injection therapy, we do have to make sure we're looking at the patients and that we have a correct patient population for them. You want to be able to visualize your penis because that's where we're going to be injecting the medication. So if you're overweight, if you have a large abdomen, that may not be the best thing for you. Maybe you have to use a mirror. Maybe you have to have a partner help you teach or help you do this. So we have to be aware of what our body mechanics are and our visualization. If you have a history of fainting, if you go and say, "Hey, I get my blood work done, and I always like faint," this may not be the treatment for you. So be aware of that, and be aware that there's other options that could be perfectly acceptable for you as well. If you have dexterity problems, these injection therapies do require drawing up medication from a syringe, being able to use your hands to be able to administer the medication. So if people who have Parkinson's, people who have arthritis, and they have difficulty with their dexterity, they may need assistance with that, and the provider should be able to provide that guidance. If you have uncontrolled hypertension, these medications can sometimes affect blood pressure. So we want to make sure that we have a good cardiovascular system in place before we start prescribing and giving people medication. And if you have any problems with the penis in terms of the physicality of it, if you have Peyronie's, which is a curvature of the penis, this medication may not be the best thing for you. So we do go into it recommending this therapy for those patients that we feel would be a good success. We also want to make sure that there are certain contraindications that we have to be aware of. If you're on a current medications called MAO inhibitors, they're not very commonly used anymore, but they're often used for depression and for different psychiatric conditions. We want to be aware of that. If you've had a penile prosthesis, these injections will probably not be the best option for you as well. So that would not be a good choice. If you've been told that you are not healthy enough for sex, when you think about it, sexual activity, it is a cardiovascular condition or cardiovascular activity. If you have health issues and you have heart problems and your doctor says this may not be the right thing for you to engage in sexual activity, we have to think about other ways to create intimacy. Or if you're at higher risk for a prolonged erection, that's called priapism. If you have an erection for longer than 4 hours, especially if it's very rigid and very hard, that's a dangerous condition and it has to be treated as an emergency. So certain medical conditions can predispose you to that. So if you do have that, your provider will tell you this isn't the best option for you.
Yeah, that's great points. And Kristen, I know some of my patients, if you have that pendulous or larger, as we get older, our abdomens get bigger. That's not uncommon, but maybe your partner can do the injection for you where they can direct and visualize exactly where the injection can go. I absolutely have patients whose partners give the injection because they can't look down and see their penis, especially back near the base where you're going to give the shot. They can't see that spot. So the partner helps. And the same with the dexterity issues. If you have a partner who can help, absolutely. You and your partner come in, do it the same way in the clinic the first time you try it under supervision, just like you do at home, and make sure everybody's comfortable and everything feels okay with it for sure. Certainly too, remember, so you might be thinking, well, is sexual activity advisable for me? Usually how we determine that is if you can go up 2 flights of stairs without chest pain, or if you can go up those 2 flights of stairs without chest pain or shortness of breath, then you can usually handle a low impact activity like sex. But absolutely, you want to make sure that your doctors say, yes, you are safe to have sex, especially if you've had a cardiovascular event. Really important. And so there are some contraindications. This isn't for everybody, but you can see clearly what those are. And sometimes we have ways that we can make it work too by involving partners. Excellent.
And I think also bringing in the partner is lovely. It kind of creates that intimacy. It creates that we're in this together. And a lot of times if a patient's nervous about giving themselves the injection, it's so much easier to say, you know what, I'm going to have my partner do it instead.
Mm-hmm.
And you can make it fun. You can kind of make it like they're role playing or something like that. You can make it like a fun thing for them so that the nervousness and the anxiety of it is really diminished. So yes, I love the idea of bringing in the partner for that.
We always encourage partners to come in. If you have a partner, we love them to be there. Sometimes the partner can just read off the instructions as you do each step of it even. It's a team effort and it can be awesome to do together. So yeah, I think that partners are everything. If you have a partner and you can, great. Let's talk, Kristen, tell us a little bit about the advantages and the disadvantages to these penile injections.
They are effective. These medications are in the 90% effective for most patients. Now, again, we have to think about what our bodies are and why we have erectile dysfunction. If we have a history of diabetes, if we have smoking, if we're obese, if we've had either prostate surgery or different pelvic surgeries, we may have a poor vasculature already to begin with, so these medications may not be as effective. But for most patients, they're very effective. They're also reliable. Once you give them the medication, you tend to know that it's going to work. Now, you have to titrate the medication. Sometimes you have to kind of figure out what the dose is going to be. So it may not work right away, but we have to kind of titrate that dose up to the dose that works best for you. But once we have that dose, these medications are very reliable. They're also mobile. You can take them with you whenever you're traveling. Most of these medications do have to be either refrigerated or frozen. So you would talk to your pharmacist and they would be able to provide you the gear or the cases that are required for you to travel. So the medication is safe and it stays sterile and it stays potent. So
And it's like a fun little travel pack, just like diabetics. Remember, their stuff has to be refrigerated a lot of times too. So they literally, the pharmacies have these little travel packs, and so they're very easy to travel with.
I agree. And a lot of times patients will say, well, how do I travel? And I remind them, diabetics have to use these. I mean, diabetics have to use it for their insulin. So this is a thing that is very common for patients to have to travel with these types of medications. And that also creates a little bit more of acceptance that they're not so unusual that they have to have this refrigerated medication to travel with, because many people with many different disease processes also have to travel with medications that require refrigeration.
Yep.
The disadvantages is, you know what? It is an injection. You have to give yourself an injection. Yes, there's nothing around it. No beating around the bush. You do have to give yourself an injection. But most people, once they give themselves the injection, it is not nearly as horrible as they thought it was going to be. And it is usually very rewarding whenever the patients are like, oh my gosh, like I was worried about that. Like that was nothing. So a lot of times it's just that anxiety and that nervousness of what to expect. So we have to be aware that is a disadvantage. The medication's not covered by insurance. At least the compound medications that we have are not covered by insurance, so it is an out-of-pocket cost. And it can be about $150, give or take, for a month to a 45-day supply. So you do have to, you do have to be aware of that this is a out-of-pocket expense if we're using a compound medication. We also have to think about, if you are applying for a job or you're having some type of like DOT physicals and you're getting urine tests, some of these medications could screen positive for opiates, so just be aware of that. But the main advantage, the disadvantage, and we're thinking about it from my perspective, is making sure that we have to use a compound pharmacy, which is a pharmacy that, it's not like Walmart or Giant or Rite Aid. It's a pharmacy that actually makes the medications right in their office. They're very common. They're very readily available all across the United States. They can mail it to you. It's very, very easy to access. However, the cost of the medication may be a factor for some people, and then just how people who do have a fear or nervousness of injections, we just have to be aware of that.
I know, I'm sure you see this too all the time, but they get past that first injection like, oh my gosh, I was so freaked out. And then I'm going to show you the needle is super fine and super small. And I'm going to tell you about my study. And there's been 2 more studies since that men don't find it particularly painful. Again, we're not trying to convince you. We're just trying to tell you the facts but it's after they do it, they're like, oh my gosh, I can't believe that was it. I was so worked up over it. And also, I don't know if you see this, Kristen, a lot of guys will have tears in their eyes when they see that erection again, and they're like, oh my gosh, there is my penis. I have not seen that kind of erection in a while.
I have a fantastic story about that. I had a patient years ago that was coming in for injection therapy. He was referred. He was in his late 70s. He didn't have a partner. He wasn't sexually active. And I was like, why are we doing this? Like, why are we like doing injection teaching? But his urologist referred him. I'm like, that's fine. Let's go ahead and teach him. Did the injections, and he got an erection, and he just stood there and just cried. And he was like, I feel like a whole person. Even though I'm not sexually active, even though I'm not with a partner, I know I have that opportunity. I know I have that chance, that I work. And sometimes I think that mental perspective, that especially that, men have, of the penis and the erection is such a part of their identity. That's how they show love to people. That's how they identify as being a man. So sometimes just knowing that they are working does psychological miracles. So I agree with you completely.
Yeah, and similar. I had this doctor, and he grabbed my hands and he said, "Oh my God!" He had tears streamed down his face. He's like, "I can't believe this. Do you know what you gave me? Do you know what you did?" And I'm just like, "Yeah, I'm pretty sure I know I'm pretty sure I know what you got." But he's like, "No, no, no." And he said, and I thought he put it beautifully. He said, "You gave me hope." Hope is so powerful. So it's like, what an amazing thing to be a part of these patients' journey. And certainly injections aren't for everybody. We're not saying that. But for the right patient, it can be life-changing, and it can be something helpful. I never push anybody into it, but I do find that once they do it, it is one of those treatments that they're like, wow, yeah, cool stuff. So we have different agents that are out there. As Kristen said, these have been around since the 1980s. This doctor, Dr. Brindley, injected himself at the AUA meeting and showed people that this works. The initial agents were things like papaverine, phentolamine, and then prostaglandin E1. Prostaglandin E1 is the single monotherapy agent that was FDA approved. Now, the others have been around forever. They have lots of signs to show efficacy and safety, but they are off-label. They are non-FDA approved, but they've been around for a very long time with excellent research and evidence to support them. But but one of the safest drugs of all of them, with a little better, a little less side effects, and especially in terms of dangerous side effects like priapism, which is a medical emergency. That's an erection that won't go away, or Peyronie's curvature, a little bit less with the prostaglandin E1 than with the combination in the trimix. The reason they make trimix is because alone, papaverine will cause scarring, phentolamine will cause scarring. But if we can decrease those dramatically, the amount we use, and mix it with other vasoactive drugs like PGE1, that's how trimix was born, and how they decreased side effects and improved efficacy. But this single agent was approved for by the FDA, and so you can get it through a regular pharmacy, and it is FDA approved. Some commercial insurances will cover it. Medicare and Medicaid do not. It is available to vets through the VA as well. Now, you're going to have limited amounts they give you, usually between 2 and 6 per month is what they'll give you of these injections. So that's a disadvantage compared to the trimix, where you have a vial and you could use it once in 24 hours, 3 times a week max, just like this one. But how are you going to use this 3 times a week or 2 times a week when you only get 2 or 4 or 6, right? And these are expensive. A single one of these medications can cost $150, and the vial might not even cost that much for a month of the trimix. Again, these are just the facts around this to understand, but this one has been shown to be safe and effective and is completely FDA approved. There's 2 manufacturers. One makes something called Caverject Impulse, and it looks sort of like this, and so that's Caverject Impulse, and this is Edex. We're not here to sell you any particular product. They're both prostaglandin E1, and that is what the agent is within them. The dosing is the same for both of them. They go anywhere from about 1 to 2 micrograms to 40 micrograms maximum. Edex comes in 3 different varieties, a 10 microgram version, a 20, and a 40. So you think, how do you get 5? You use half of a 10. Now, it's a one-time use thing, so you can't save the other half. But if you use 2.5, you use a quarter of a 10. If you use 15, you use 3/4 of a 20. So you can use all different doses, but they come in 10s, 20s, and 40s. I'm going to show you how to prepare that. But edex.com has an excellent patient training video. You can see that at the bottom of the screen, edex.com. They have a training video that shows you exactly how to do this from start to finish. And they have a training sheet that you can print out. It's a patient instruction sheet that you can print out. But while we're here on edex, I'm going to go ahead and show you step by step how you do this in just a second. And then when we get to the other mixtures of bimix, quad mix, and Kristen talks about that, she's going to show you how you would draw up that medication. But first, let's just show you a little bit. So with this one, this is called Caverject Impulse. It's a really interesting product. So what you do with this one is you have a needle that goes on the end of it, and it comes with it. It's a one-time use thing too, but there's a needle that screws on to the end of it like that. And then now you have a single-use needle, and then you have this device. When this device, you go through the steps, and you can go on the Caverject website and look at how to do this as well. And when you screw this in, it will force the liquid and powder together. When you push in, it pushes it so the liquid and powder mix. And then there's a little, you can hardly see it, but there's a window right here. That window will show the different doses, 5, 2.5. The 10 microgram has 2.5, 5, 7.5, and 10. The 20 microgram has 5, 10, 15, and 20. And you roll to your correct dose. And then once you're all ready, the needle is here, and you give it to yourself in the penis, which we'll show you later, and you push the medicine in with the plunger. This is the plunger here. So that's Caverject Impulse, and they have a wonderful video that shows exactly how to do that if that's what you've been prescribed, and one-on-one, your prescriber will teach you how to do that. Now, edex is a Tubex system, which nurses are very familiar with. This is called a Tubex. And this blue Tubex, when you're trying to remember, what do I reuse? This is what you reuse. This is the reusable part of edex, okay? And so what you do is you have this. You're going to set this down for just a minute while you prepare. You have 2 alcohol wipes. There's 2 of them. You have a needle, and you have a cartridge. Each time you want to give yourself this drug, you have a new needle and a new cartridge, and they're one-time use only. So, and they're inside here, and they're sterile. So what you're going to do is you're going to open this package, and how you're going to do that is one of the ends has a little paper tab, and you're going to pull it across like that to open it, and now we've got everything inside. There's a needle in here. The needle has a little paper tab over it, and it should be intact. We're going to pull the paper tab off. There's a needle on this end, and there's one underneath here that you're going to inject into yourself. But this needle is going to pierce something in this. So this is your needle, right? And so, but you're going to use that in a second. And actually, when you watch the steps, the first thing you're going to do is you're going to take the cartridge out. You're going to clean it with your alcohol, because there's a little stopper on the end that is going to be pierced. That's why I wanted to show you the needle first. But that needle has a needle on both ends. The needle will pierce this cartridge so that we can deliver this to you. Take out your alcohol wipe and wipe that little stopper on the end of your one-time use cartridge. This has the drug in it. See the liquid down here at the bottom? That's liquid. You can see that liquid, and you see that little bubble at the top. And this powder is the actual drug. So now what you're going to do is you're going to load this into your reusable Tubex system. So you're going to unscrew this. Okay, let me show you again. So here it is screwed together. And so what you're going to do is you're going to unscrew it. Yep. And now we have the two pieces, the plunger and the part that you're going to load the cartridge in. You're going to take your cartridge, and there's a little notch on it. It may be hard to see, but it's right there at the top. See it? And we're going to line up that notch with the groove. I just put the groove on top and the notch is on top, and that notch and groove, it'll slide right in. If it's not lined up, turn it till it is lined up and it'll slide in. I like to take my finger and push that against that, push that down in there so it's in there. And then now we're going to put the plunger back on this end of it like this so that that's together. On this end, we have what we've done. What we're going to do now is now you would tear the paper tab off of your needle, which should be intact, right? You've already cleaned this. And now we're going to screw that needle onto the end of this device, okay? When you're doing this and you're doing it in order, I wanted to show you the pieces and make sure you understood it. The first thing you're going to do is you're going to pull off the paper tab on the needle and screw it onto this reusable thing, right? So you're going to screw it on here before you put the cartridge in so it's ready. So let me show you the steps again one more time, and I'm going to show you step by step how you'll do it at home. So you got your needle and your cartridge. So the first thing you're going to do is you're going to take your needle out of here. You're going to take pull the paper tab off, and all this is on edX.com, and you're going to attach it to your reusable plunger, right? And your reusable plunger is not taken apart yet. It looks like this, and it's the blue thing. This is what you're loading on when you remember it's blue. Screw it on here till it can't go any further. You got it on there now. Okay, it's screwed on. Now remove the other end because we're going to insert the cartridge in there after we clean it. We clean it with a alcohol wipe, and we line up the notch and groove, and we push it in there. Now look, if we give it a little push, it's going to go right up against the needle. Even if you don't, when you put this plunger back on, if this is in your way, drop it out of the way. When we screw the plunger back on like that, now it becomes one piece. Plunger's in place, medicine's here, needle's on. So we put the needle on first, we cleaned the cartridge and loaded it in and put it in, and then we reapplied the plunger. Okay, that's how you put it together. It's all listed in the patient instruction steps, and it's all on the video. So watch that. Very, very important from edX.com. Now, we've got liquid and powder, but we have to blend the liquid and powder together so it can actually be injected. It's not mixed yet. That's why this doesn't have to be refrigerated or frozen, because it's not mixed yet. It's still powder and liquid. It has an expiration date on there. Make sure you check it, but your drugs have an expiration date. And then now you're going to mix it fresh right before you give it to yourself. So when you push straight up on this, I'm going to push on this, and it's going to force the liquid and powder. See how the liquid and powder have merged together and the two stoppers touch right here? Two stoppers touch together, and the liquid and powder are now together above those two stoppers. And you're going to mix it by gently rocking it back and forth. You can roll it between your hands, rock it until it becomes completely clear. That is your medicine. And so you're gently rocking it till it becomes clear. If it doesn't become clear, you're not probably going to want to use it. And then you're also going to want to get all your bubbles up to the top. Flick them up to the top. Once you've got all the bubbles to the top, now when you push up, the air is going to come out and all the bubbles will come out because the air is lighter than the liquid. To do that, we're going to take the outer cap on. Now, in the instructions on edX.com, it'll tell you to take this off, which you can. Absolutely. But I have my patients leave it on because the air and the liquid will come right around it, and this will protect the needle when you set it down before you give it to yourself. So you could leave the pink cap on and the air and liquid will come around it. If you don't leave the pink cap on, your needle is exposed, which is okay. Don't let it touch anything. No surfaces, your finger, nothing. But if you leave it on, it won't touch anything. So I tell you, one exception to what they teach you online is to leave the pink cap on till you're ready to inject it because it will protect your needle. Push straight up now. Get all the bubbles to the top. Push straight up like you've seen in the movies to get all the air out. And you can see the little bubbles, the liquid. You probably can't see it that good, but the little bubbles up there next to it. See them next to the needle right there? It will come right around that cap, and that cap will protect the needle so that it's not exposed. So and then push up to your dose. There's little markings on here, and work with your provider on getting rid of the medicine. If you're using half, you come to the 0.5 mark. If you're using a quarter, you come to the 0.25 mark. So here I'm going to pretend like we're using 3/4, and I'm going to come up and I'm going to waste the extra and come up to the 0.75 mark. Okay. So that's what I did. Now, that's how you get the medicine ready. Now the medicine has been, so there's the main steps are assemble it, put the needle on, clean and load the cartridge, reattach the plunger, assemble it, mix it, powder and liquid, so it becomes liquefied. When the two stoppers touch, mix it back and forth, and then get all the bubbles to the top, push the air out, and get your correct dose. And now it's ready to go. Set it down until you're ready to inject, and we'll show you how to inject in a minute. Okay, there's lots of steps to that. I know, and that can be overwhelming, but all the steps are listed on the patient instruction and all of them in the video. They will become second nature, but you've got to, that's where your partner can come be really helpful because they can read them off to you, but you've got to double check yourself each step of the way. And this is always done under supervision the first time in the clinic. So you know how to do it, and you know how to do it safely. There's a patient instruction sheet and a video on edex.com. It's a lot of steps, but you get the idea. Okay, now that was long, but now we're going to go over to the trimix and bimix and quadmix. So let's go back to the slides. All right, so that's Edex and Caverject Impulse, which are the two FDA-approved ones that you can get at a normal pharmacy, but they are more expensive, of course. And but you can get them from the regular pharmacy, and you get them with a prescription, and you learn how to use those under supervision. And those are the steps to the two different agents, the Caverject and the Edex. But since the 80s, here's what we've had, and I alluded to papaverin. Papaverin and phentolamine is bimix. Trimix adds in the PGE1, which you just saw was Edex. So now we have 3 drugs, including the FDA-approved one, mixed together. And that's so that we can minimize side effects of papaverin and phentolamine and maximize efficacy using 3 agents instead of 1. And then the other mixtures, the super trimix and quad mix, which are just stronger versions, super trimix, of the same 3 drugs. Quad mix adds in atropine. I rarely use quad mix, but there are people out there that do. I don't find atropine to be a great agent, and sometimes I think it affects sensation. Do you use quad mix at all, Kristen?
Very rarely. If a patient was coming to see me who was already on quad mix, I will continue it. But if they're, I don't use quad mix. If they're not having success with super trimix, and the nice thing about these compounds is you can increase these individual agents. You know, the super trimix might be 3220, like this slide says, or it might be 3240, or you might be able to increase the phentolamine by a little bit more. So you can kind of increase them a little bit more individual if you are able to. But the quad mix is, it's.
So we don't use it. The only time I use it too is if somebody comes in on it. I'm not going to change what's already working for you and not causing you any problems. Same as you, Kristen, exactly. There's nothing wrong with quad mix, but across the world, the most popular is the trimix and super trimix you see here, but they can be tweaked a little. Papaverin at 30 is maxed. We don't tweak that. We don't go up on it. We can go down on it though. We can go down on any of these agents. On the mixtures, we can go up on some of them. So they can be customized a little bit sometimes, but all this is done prescription, non-FDA approved through your provider and under supervision. So next, why don't we go to Kristen, and Kristen, just show them. Now this is going to look, I'm going to tell you right now, this is a lot simpler because this is a multi-dose vial just like insulin, and all you're going to do is draw out your medicine each time with an insulin syringe. You don't have to mix it, but because it's pre-mixed, it has to be frozen or kept cold at all times. The Edex and Catraject are mixed fresh right before you get it, so they do not have to be refrigerated or frozen. They can be kept at room temperature. This one does because it is already mixed and ready to go. But the beauty of that is, you're going to see in a minute, very simple to get it ready. You don't have to mix it and do all the things I just showed you. So Kristen, take it away.
Yes, and it's interesting that they, looking at these like syringes, this is, there's so much technology nowadays, right? You have like the insulin, which is the insulin pen. You have like the GLP ones that are like a pen. They're so like fancy. These are not fancy. These are the old fashioned ways, but if it's not broke, don't fix it. All right. So this is what an injection looks like. So you're going to get a bottle. It's just like a regular old bottle from the pharmacy. And this is usually about 5 cc's. That's the maximum dose of medication that you can use, typically from the compound pharmacies. They will also give you a syringe. This is just an insulin syringe here. And you can see that this syringe here goes from 0 to 100. So it goes, lots of room to improve if we need to. So this goes from 0 to 100. And I'll tell patients, it's okay if you use 70, if you use 80. Like, we don't know what your dose is going to be, and that's perfectly fine. But we always start off at a low dose. Maybe we'll start off with either 5 or 10 in the clinic just to see how you respond to it. But then you can increase it at home until we find the dose that works best for you, which is very, very good. We don't want to increase it more than 5 units at a time. So we do want to go slow. So I always tell patients, be patient. Be patient with this process. Like, once you've learned the injection, that's kind of the easy part. The next part is being patient to try and figure out what dose works for you. And let's say your first dose was alprostadil, and you use a certain amount and it wasn't working, and then we changed you to Trimix. So you kind of tell patients in advance that just be patient. It may take some time, but we will find the dose that works best for you. So this is a syringe. This is kind of what it looks like. And just like what Jeff said, you're going to have the bottle. Make sure it's always clean with alcohol. This bottle here can be reused. It's usually a 30 to 45 day use for this medication. And then you'll get your syringe. So this syringe here, because this bottle, to get the medication out, we want to put air into it first. This is vacuum sealed. So let's pretend your dose was 20. Your dose was 20, so I'm going to get my syringe. I'm going to pull back on this white plunger until my black line is at 20. So now I've got 20 of air. So I'm going to go ahead and put that 20 of air right into the bottle, inject the medication or inject the air, turn the whole thing upside down. Very, very simple. And then you're going to go ahead and pull back until we get to your dose. So let's say your dose was 20. So now I have a little bit more than that, because just as even what Jeff said before, you might have air bubbles in here. So we want to get those air bubbles out. So what we'll do is we'll flick this a few times, just like what Jeff said. We'll make sure after we flick that a few times, we go ahead and squirt it just until we see some of that liquid come to the surface, so that we know, you might have been able to see that liquid come to the surface, that the air is gone and we have our right dose. So that's what an injection looks like with the compound medication. It is pretty simple. It is pretty simple. But this here, if you're looking at it, I'm just trying to find if I can get a little bit of a background. Maybe not. The needle itself is so skinny. You can barely even see it from this angle. Sure. It is just a skinny needle. And it's usually a 1/2 inch. We can go a little bit shorter, but this is a typical size and length. So it's very, very fine. So that means you don't feel it very much at all whenever the needle goes in. So that's what the compound medication looks like. You do have an individual syringe. The syringe you throw out, you do not reuse the syringe. And just like what Jeff said, if you're drawing up the medication's cloudy or has any particles in it, we don't want to use it. We want to make sure we have a nice clear fluid. But that's the simple version.
So either way, that's what you're going to do. Again, it's so hard to see these needles because they're so fine, but I'm showing you now, this is the tip of that needle. That's really close up, but I'm just showing you that's how tiny it is. Look at it next to me. That's how tiny it is. And the same thing with the edex. It's the same size needle. It's a 1/2 inch long, which is the exact right length it needs to be. Sometimes people try to use shorter ones, and I find that gets us into trouble because you don't get through the corpora with some of those. But it should be a 1/2 inch long, and then, but it's very, very fine. It's usually 28 to 30 gauge. That is a super fine needle. So that is a little bit on how to get your dose ready. And remember, it's a prescription. These particular ones you see here are non-FDA approved off-label, and this one back here, maybe, can we go backwards? No. Let's see, the slides are stuck. So let's see. Oh, there we go. So the FDA edex one, that is the FDA approved one. Again, you can get that at any pharmacy. They may have to order it, but and it's covered by some commercial insurances. It is available through the VA. It's not available through Medicare or Medicaid typically. And so, and they do cost sometimes about $100 to $150 per shot. And then the non-FDA approved ones come in the vial. Let's go back to yep. And those come in the vial. And so they're a multi-dose vial, and it's usually a 30 or 45 day. All that will be on your vial, and the compounding pharmacy will have that on there. You have to get it from a special compounding pharmacy. And you'll get syringes and you'll get alcohol wipes. Okay. So that's the medication. Let's go on. Vic, if you need to, yep. Side effects. So pain, yes, you can. The drugs themselves, especially the prostaglandin E1, can cause some pain. Yeah. And so the drug can cause some pain. It can cause a burning type pain in the penis. About 1/3 of patients get it. We don't know who will get it with the PGE1, but if you get that, it can be taken out. That's why we would use a bimix. Instead of using 3 agents, you could use 2, or you could switch over to the trimix to use less of the PGE1. But pain and burning are mostly associated with alprostadil, which is prostaglandin E1. You can also get, of course, bruising and bleeding, right? And we're going to teach you that to press for 5 full minutes afterwards, especially if you're on any anticoagulant like aspirin or any anticoagulants to thin your blood a little because of other issues. Even if you're not, you want to press for 5 full minutes. And I'll show you how to do that in a minute, because you kind of encircle the medicine as you're pressing to keep it local, and you can reduce bruising and bleeding. Redness, swelling at the injection site, priapism, which is a serious, serious condition. I know you might be thinking, wow, it would be great to have an erection that lasts 4 hours, but I'm telling you, it is literally a medical emergency. Because think about it. Your penis is really hard. The blood is no longer moving back and forth. You need oxygen and nutrients to move back and forth. And so, Kristen, talk a little bit more about this. I'm going to grab my plug so that this doesn't turn off, and I'm going to let you talk more about the side effects while I do that.
Sure thing. I think with the alprostadil, the single agent, sometimes you can have what Jeff said, you can have some burning with that. That can sometimes cause some pain. So I usually tell people, if it happens, not a big deal. Don't worry about it. We'll just adjust the medications. We'll adjust the ingredients. It's purely fine. With priapism, it can happen, but whenever we go at a very low dose and work our way up slowly, we really do minimize that from happening. Now, we do have some patients are very eager, and they'll increase the medications higher than what we recommended, or there might be medications that will combine it with Viagra or Cialis. So we don't recommend that. Sometimes we do, but we will tell you that. But most time these are single agents, and if we add another medication on it, the chances of you having a prolonged erection are going to be higher. And what Jeff said is, it is a medical emergency. If you think about it, if you have decreased oxygen to that part of your body, that's not healthy. If you have decreased oxygen to your heart, you have chest pain, and that's a medical emergency. If you have decreased oxygen to your penis, you have penis pain. And then we have to reverse that, because you want to be able to use your penis in the future. You don't want to cause permanent damage to the penis. So we always tell these patients this, and they get very scared, like, oh, I don't want to do injections at all because I'm afraid I'm going to get priapism. We tell them this so that they do not increase the medication higher than what we recommend, because this is a very safe medication when given and when administered by a provider who knows this medication. So sometimes we do try to scare you a little bit, but that's for your own protection. But if you're doing this under our local or during, if you're doing this under our observation and under our recommendation, the chances of these side effects happening are minimized.
And that's why you want to work one-on-one with a skilled provider. But so we start low, we go slow, and you have to start low and go slow. We tell you to go up by 1 or 2 units with the trimix and bimix, or 1 or 2 micrograms or so with the edex. We go up very slowly because we don't want priapism. And if we do that, we're usually pretty successful with avoiding that problem. And we literally will give you instructions to take to the emergency room, and they will help you. If you have an erection, even that lasts 2 hours and is very hard for 2 hours, you can go ahead and go get treatment. And the sooner you get treatment, the easier it is to give the antidote or to bring it down. You can imagine if you fell asleep with it, it could be very dangerous because the blood is literally trapped in there and it starts clotting. It can be a very serious situation and cause tissue damage and death. But that is quite rare because if you do it correctly, really carefully, and you slowly titrate, it should go well. And if you have any problem, you go to the emergency room, they will give you the antidote and resolve it, and you'll be okay too. So we do put a little bit of fear in you because it's so important to address it because we don't want to cause any damage. Safety is always our very first and foremost important thing. So that's why. And then scarring or curvature. So that's why we say once in 24 hours, 3 times a week max, because we don't want to do too many injections. We don't want to cause scarring. We don't want to cause problems. So we do a lot of things to minimize these side effects. And like you, Kristen, I've had men on these drugs for years with none of those problems for many years, decades, in fact, right?
Yes.
But the thing is up to about 10 to 15% can get a priapism or scarring, possibly. It's a little lower with prostaglandin E1 as a monotherapy, but under the right supervision, it doesn't happen that often. And if it happens, we tell you exactly what to do. So you'll have all the information you need either way. But these are important things to talk about, and make sure you have that. We give you a little half sheet of paper, and I'm guessing you do something similar, Kristen, that you bring with you to the ER so anyone knows exactly how to help you resolve it immediately. You should not be sitting out in the waiting room waiting with that erection. You need to be taken back in and treated because it's considered a medical emergency room, a medical emergency if it were to happen. And again, many men, it will never happen, but you still have to know what to do in case it happens because it's a serious thing. And so is scarring. We don't want scarring on the penis. So those are important things. And they don't happen very often, but you still have to know they can, because they do sometimes, and what to do if they do. So let's advance to the next slide, Vic. So how do we do all this? You come in and first we usually give you the information to read and study and prepare yourself. And then we have you come in with the medication, your own medication, ready to do it. Some clinics may have the medication on hand. We typically have you bring your own medication in, so you're working with your own vial, your own syringes, and that's how you do your first injection in the clinic. But either way, you do that in the clinic. You do it just like you'll do it at home. If your partner's going to do it, then your partner does it there. If you're going to do it, you do it there. Whoever's going to do whatever, have them do the same thing in the clinic so that you've done it once and had a success already with a very low dose to start with of whatever your agent you're using. And then we'll tell you next, try this dose. And then typically you'll go up by very small increments till you find the correct dose. While you're trying to find the dose, you'll probably use it once in 24 hours, 3 times a week until you lock into the right dose. And then you only need to use it when you want to have sex. But in the beginning, you may use it a little often, more often, no more than 3 times a week, once in 24 hours, but you want to find that dose and figure out what it is. But as Kristen said earlier, once you figure it out, you know exactly what's going to happen. It will last usually the same amount of time each time. You know how long it's going to last. You know exactly what to expect because it tends to be pretty reliable. Once in a while, you may miss and hit a vein. Usually that just means you didn't get an erection. Wait 24 hours and you can try again. But so you study the written information, you watch the videos if you're using EDEX, you read over everything carefully, and then you come in the clinic ready to try your first dose. Let's go to the next slide. And then you try it in the clinic. Now, how do you do it? So you can see there, you're going to grasp the penis by the head. If you have a foreskin, you're going to push it completely back so you can grab the head. Because if you accidentally stick the needle in the head of your penis, you are not going to be happy with your provider. It is going to be very uncomfortable. We do not give this drug in the head of the penis, and that's why push back the foreskin, grasp the head firmly, don't twist or turn, and I'm going to show you this in just a minute with the model, and then give the injection. We tell you to give the injection just like you drive at 10 and 2, so on the side. So if this were your penis, my finger were your penis, this would be midnight, and you would give it at 10 over here at 2 o'clock, or you'd give it at 10 o'clock. This would be midnight. Some people do down a little bit straight in at 3 o'clock or straight in at 9 o'clock, and that would be okay too. But you don't want to angle into 3 or 9. If you're angling, you should be right at 2 or 10. So, and then let me show you on the penis. So here's the penis model, right? And so here's midnight in the middle, right? Here's 10 o'clock over here. And here's 2 o'clock over here. So here's midnight, 1, 2. Here's 3 o'clock, but you go straight into 3 or you go here at 2. Here's 10 o'clock, straight in at that angle to 10. But if you're going to do over here, then at 9, then you're going to go straight in because we don't want to get down here in the urethra. The urethra is on this bottom side, and we don't want to go into there because then the medication and blood will come out the tip of your penis. We're shooting into the corpora cavernosa, these two cylinders, not the blue, but these cylinders on each side. So here's the penis again, and we're shooting into these very vascular areas on either side. Here again is 10 o'clock, here again is 2 o'clock, and see, we're shooting into that white cylinder, which is the corpora cavernosa. The corpora cavernosa on each side, and we rotate sides so that we don't go in the same spot all the time and get scar tissue. And you can go anywhere along here from next to the base of your body to down here. Don't go down by the head of the penis, but you could inject anywhere in this area, on the other side, anywhere in this area, and at 10 o'clock or 2 o'clock, if you do 3 and 9, straight in, don't angle, straight in, but that's how you give those injections. And so, and again, one more thing while I'm showing you that, here's your needle. How far does the needle go in? Okay, the needle is meant to go in up to the hub. This is the hub. So after you clean the skin with your alcohol wipe, so you have your second alcohol wipe, this is why, because you clean the skin with your second alcohol wipe, and now you've got your medicine all ready to go. It's drawn up and ready. And now you pierce the skin and you go all the way in. Look at that. You don't see part of the needle. You don't see me pushing too hard. It's just into the hub. And then you hold it between your fingers as you push the medicine in. You don't, if you push and pull, you'll pull the needle out. Hold the needle completely steady as you push the plunger all the way down to instill all the medicine. When the medicine is instilled, you can remove the needle and take that same alcohol wipe and press by putting your fingers on one side and your thumb on the other side. Fingers and thumb. Or you can do thumb and fingers. Either way, but encircle it with your fingers and your thumb, pressing over that injection site for 5 full minutes. So pressing that injection site for 5 full minutes. Okay? And that's how you do the actual injection. Remember, the needle goes in up to the hub, So you don't want to be pushing too hard where you're pushing the hub down into the skin, and you shouldn't see part of the needle. It should be all the way in. And so that's how you would do that injection. And again, your provider will show you exactly how to do it in your particular case, but that's a general guideline. Okay. So remember, you got to figure out how you're going to hold the needle. You could hold it between all your fingers, between these two fingers, but you got to steady it and hold it steady once you get it in, and then you got to have something to push with. If you hold it this way, you could still push with your thumb. You could do it this way. Some people like to push with their index finger and hold it between. You figure out what's comfortable. I find this most comfortable between these two fingers, sort of like, I guess you think of a cigarette, and then hold it steady and push. So, but you could do it whatever way you find comfortable, but you got to hold it steady as you push the plunger. Back to the thing, Vic, again, don't twist the penis. Sometimes as you're doing it, you want to twist, and then you'll get down here in the urethra. So just hold the penis steady, and you can kind of hold it against your thigh. See how it's straight? And now we can go straight in. But if you twist, you're going to get down here in the wrong spot. Again, if you hold it steady, fine, and put it up against your thigh, but don't twist it as you turn, because now you'll get down here into this yellow area where you do not want to be. That's the corpus spongiosum, where the urethra is, where the urine comes through. Okay. It's a lot, I know, but hopefully it all makes sense. All right, let's go to the next slide. We've taught them how to do the injection. Anything else on that, Kristen, that you had?
I think some of the things just to kind of reassure men is that sometimes they'll look at that needle and they'll be like, that needle is going to go right through my whole entire penis. That needle is so long. You're not going to go through the penis. So I always try to like reassure them that that's a very common, thought that men have. It was, very reassuring that, that's not going to happen, but that needle length is there for a purpose, the 1/2 inch, kind of just reiterating that. And also just making sure that you're looking at the anatomy each time, because you want to avoid the veins. So if you're like, hey, listen, whenever I was in the clinic and I injected here with Kristen, that might not be the same injection spot that you're going to go to later on. Depends on how taut you have the penis, or kind of like how you have the penis is. Always look right then and there whenever you're injecting yourself, just to make sure that you have the correct anatomy. It sounds harder than it is. It's not. But we're just providing lots of information.
We are. And so like veins, you can see the veins in my hand. You can see veins there. You have veins on your penis. If there's visible veins, avoid them. And then give them in the spot we teach you to do it, and rotate the spot so it's not the same spot constantly. You can go on the right or the left, and you can go anywhere along where we showed you. So, and then apply 5 minutes of pressure after you swiftly remove the needle by encircling the penis like we showed you. We've showed you a lot of information packed in this one. Let's go to the next slide. We talked about the direct pressure. We talked about avoiding the visible veins. We talked about not twisting and rotating. We've been through these guidelines, Kristen. That's good. And so the 10 and 2 is where you use the angled approach. If you do 9 and 10, you do the straight in approach on the penis. So we do straight in at 9 or 10, and we do angled if we do the other. And so we showed you syringes and needles, whatever it is, whether you're using the kit, which is the Edex, or the kit, the Caverject, one-time use only, or whether you're using the insulin syringe, one-time use only with a multi-dose vial. No more than one use in any 24-hour period, even if you don't get a full erection, and 3 times a week maximum. That's what the guidelines say in the patient instructions from the FDA as well. And follow your provider's guidelines. And lastly, pain. So you're thinking, you say it doesn't hurt, but what do patients say? So don't listen to Kristen and I, because we can only tell you what patients tell us. But this is the study I did, the first study to look at pain. And what we found was 40% of those men who did the injection, right after they pulled the needle out, we said, rate the pain with the needle, 0 to 10. 40% said 0. I felt it go in, but I literally had no pain. Of those who had any pain, the average pain rating, remember, was 1.33. So 1 or 2 out of 10, that's a very low pain rating. So most men found it virtually pain-free or not very painful. Interestingly, the patients who had their partners did it said it was more painful from their partners in some of these studies than themselves, maybe because they weren't controlling it, which I thought was kind of funny too.
Mhm.
But in general, whether your partner does it or you do it, most men find it a very low pain, if any pain, from the needle stick. The pain comes in when the drug kicks in, the prostaglandin, if you have that, and only a third of patients get that, and it feels like a little bit of a throbby, achy pain in your penis. And the meds can be adjusted, as Kristen said earlier, to minimize that by minimizing that drug that causes that. So you can see that pain is not typically an issue except the medication pain, which you can see in our study too, happened in about a third, and that's what other studies say. Now there's been 2 subsequent studies that have also shown those pain levels of about 2 out of 10 is the average. So most men do not find that needle stick painful. But if you have pain from the medication, your provider can adjust things. So that's a little bit about needles and medication pain. Let's go to the final slide. Well, why are we so happy that we at least have this treatment option? Why do you think, Kristen? Because they work for most patients. 80 to 90% of men in studies will get an erection sufficient for sex. That's not everybody, so they may not work for you, but they do work for the large majority of patients, and they work pretty consistently. You don't have to wear rings or have the mess that you can have sometimes with the vacuum pump. So it's a trade-off. Vacuum pump's non-invasive. This is more invasive. You have to wear a ring with one, and it's more messy. This one, you don't have to do those things. So there's good and bad with every treatment. What's right for you? That's what really matters. And then, although that you can get pain from the medication, we can make adjustments to fix that. And then most men don't find the needle that painful, but sometimes men are afraid of the priapism, and that is a legitimate fear. We would teach you exactly what to do if that were to happen. They're also concerned about scarring. All of these are legitimate things. There's good and bad with everything. We're not trying to convince you to do injections. But if you do them, I have found that patients, if they do them consistently, are pretty happy with them. But I'll be honest with you. The studies show the dropout rates, because now if it's not working, you're going to drop out, or if you don't like it, you're going to drop out. They can be greater than 50%. But I will tell you, my patients who embrace it and are comfortable doing it are pretty happy with it. What do you say about that, Kristen?
I agree. This is really my favorite option that we have for erectile dysfunction. It is just a reliable, it's effective. And I think one of the nice things about it is that with the pills, you have to be sexually stimulated. You have to have foreplay. You have to have sexy thoughts. You have to be in the mood for the medication to kick in. With these, you don't. These are smooth muscle relaxers or vasodilators. Like once you give yourself the injection, typically in 10 minutes, you're going to get some type of a response, whether you want one or not. So it's nice to have that reliability. It's nice to have that reassurance. So it's really I just wish more men knew about it. I wish we kind of normalized. This is a normal part for aging for us as we get older and with different medical conditions. And this is just a really nice option. As Jeff said, it's not for everybody, but just providing you education that this is an option for you to consider.
And that's something else too. How long does it last for you? Because it could last anywhere from 10 or 15 minutes to an hour. That's not that unusual. And usually it will come and go the same way every time. That reliability and consistency, my patients find that pretty well there. But you need to make sure it's bendable and gone before you go to bed and go to sleep is another really important thing. Because if you wake up 8 hours later with that you have a really big problem. Or even, well, most men, we don't wake up 8 hours later. If you wake up an hour or two later, still, you don't want a prolonged erection. So you want to make sure it becomes bendable or it's gone. And it may not go down when you climax. Now, the beautiful thing about that is you could have sex again another time. If it's lasting, let's say, for example, 45 minutes to an hour, you might be able to have sex a second time. But you do want to absolutely make sure that erection is going away before you go to bed or go to sleep or whatever you're doing. Don't forget, it's very important to make sure that erection is gone away or going away and is easily bendable, because we don't want it to be, you don't want to have any problems. But you will find some pretty good consistency once you get going with it. We have had so much information packed into this. It's a lot. We did not mean to completely overwhelm you, but I hope that it helps people really understand. We could talk about this all night long.
Mhm. Yes.
But let's do our several things that we like to do at the end of the podcast. I'm going to do a closing centering exercise next, and then we're going to talk about what's coming next week and close out this really important episode that gave you a lot of information. So you have heard all kinds of practical, honest conversation about penile injections, which is an important tool for men in reclaiming sexual function and confidence. But now that was a lot. That was a whole lot. So let's take a moment to pause and reconnect with your miraculous, beautiful self. Gently close your eyes if that's comfortable for you, and start your breathing pattern with a slow, steady breath in your nose, about 4 or 5 counts. Exhale fully through your mouth, 5 or 6 counts. In through your nose, out through your mouth. Continue that breathing pattern and notice any tension in your shoulders, your chest, or your jaw. Soften these areas as you breathe out. Release any tension in your body. Now bring your awareness into your body, your heart, your breath, your sense of presence. Remind yourself that sexual health is about much more than performance. It's about connection, confidence, and self-acceptance. Take one more deep breath, nourishing breath in, and exhale. Let that sense of calm and possibility settle within you. Big breath in, and exhale fully. When you're ready, open your eyes, grounded and present in this very moment. Now, Vic, what's up next week on Dr. Jeff Talks About Sex and Intimacy?
Anne Russo, theologian and author, joins Dr. Jeff to discuss reclaiming female sexuality through Christian tradition and healing. They explore how Christian teachings shape women's views on sex, desire, and worth, reconnecting with bodies and spirituality positively. Anne offers tools and insights to empower women in achieving sexual autonomy, self-trust, and alignment with their values. Join us on October 21st at 7 p.m. Central Time to learn more.
So that's going to be a great episode, and we're going to unpack some of the unhealthy sexual messages you might have heard through some of through religion and different things, and we're going to unpack the healthy sexual things that you should know according to that as well. So I'm super excited about our guest next week. It's going to be a great conversation. But this week, Kristen, oh my gosh, thank you so much. What a great episode. I can't thank you enough. Any final message for listeners about penile injections tonight?
No, I hope this provided lots of reassurance. I hope this provided lots of decreasing anxiety and worriness of this. Hopefully this provided normalcy, that this is a very common thing to be going through erectile dysfunction, and that, you're in control, that there's lots of different options. This is just one in a lot of different therapies for you. And hopefully this provided some guidance that you can provide this to your provider for future reference.
Absolutely. So remember, 1 in 5 men in their lifetime will have erectile dysfunction. By the age of 60, about half the men in your age cohort will have erectile dysfunction. So as Kristen said, you are not alone. And we've talked about this extensively on the program before. Remember, you have lots of different options when it comes to treatment. You know about the pills. We have the vacuum pump. We have the shots. We have the penile implant surgery. We've talked about them all on this podcast. So go back, look at some of those things, learn more, empower yourself. Empower yourself and know that you are not defined by any of your health conditions. You are so much more miraculous than any of those things. Have a good one, and thanks for joining us.
As Dr. Jeff talks about sex